I am Dr. Agnivesh Tikoo, spine surgeon at Apollo Hospitals, Navi, Mumbai. Today, I will be speaking to you about the back pain which happens in people who do work from home. Because of this pandemic, a lot of people now have to work from home, either because of choice or because of compulsion. And this has changed the whole working scenario from working in an office on an ergonomically good desk to people adapting to conditions or the things which they have at their home to work. So first and foremost important thing is that if you're working from home, you should have a proper chair and table to work. People who try to complete their work or do their work sitting on the bed or lying down or on the floor get back pain after some time because our human body is not built to work in these postures for a very long time. So if you are working from home, please get a proper chair and table and take frequent breaks in between. So after every 25 to 30 minutes, you should just take a break. Maybe you can ease off your shoulders, just move them a bit, or you can just get up and take a walk around and come back and sit again. Taking a break is very important, as is choosing a perfect table and a chair. So whenever you choose a table and a chair, there are few things which you should keep in mind before you go ahead and make your decision to choose the chair. The first is that the chair should have adjustments which are possible for the backrest, for the seat, as well as for the armrest, and should also have a headrest. So having a headrest is important because it gives you a time to sort of relax your head in between, lay off, and your neck muscles and all get relaxed. The chair should have an adjustable lumbar support which you can move up and down so that your back is well supported. Your upper back should be supported by the chair. Your buttocks or the back of your hips, they should be touching the backrest completely. And while doing so, your feet should be placed on the floor in a way that they are not dangling in the air, nor is it too low that your knees are getting above your hip level. There should be a 2-finger width gap between the edge of the chair and your calf when you are sitting. And ideally, the terminal part of your thigh, just above the knee joint, should be slightly off the chair when your feet are firmly placed on the ground. If your feet are dangling in the air, you can choose a footrest to keep your foot rested on the floor. And the height of the table should be such that your elbows are at 90 degrees and those elbows should be supported on the armrest so that the whole weight doesn't come on your shoulder and through that to the neck. And your hand should be rested on the keyboard rest surface and you should be typing with gentle finger movements rather than pointing taps or sort of pressing with your fingers. If you take care of these basic things and your vitamin D level is good and you do regular back exercises, I don't find a reason that you should have back pain, and you will be able to get through this period gracefully and without pain. Thank you very much.